Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. And on behalf of Mayor Strickland and Mayor Harris, I want to welcome you to the Joint Task Force update for Thursday. Today we have several people that are here. I'm going to give brief updates as I always do, make a few comments, and then Tiffany Collins with the City of Memphis is here to talk about testing events that are available to the public this weekend. And then Dr. Randolph will finish up with some additional comments and we'll open it up for questions. I want to start with really noting what's becoming more and more evident to me is that this is really the biggest peak that we've experienced with the pandemic, and it is at a very difficult time of year. So I really want to reinforce that it's a lot of anxiety and depression and other things that are related to the pandemic. That's not just happening locally, but that's nationwide. And that together we can get through this, but it is going to take each and every one of us to do what we can to reduce not only the transmission of COVID, but the impact of that transmission on our community. Not just limited to schools and healthcare systems, but also on our businesses and other amenities here locally. So it's critical that we take every step that we can as individuals and as organizations to reduce transmission. So again, I'm going to share some updates, and not only our regular updates, but a little bit more information around our additional interview tool and information we've gleaned from the last 300 or so interviews, those that happened in November. So we do know at the current time we have about 471 new cases on average over the past week. That is above our tripwire of 450 new cases per day, and our case rate now is 49.3 per 100,000. So that's been an increase over time. I want to talk a little bit about our death rate. We haven't given that data in a while. So I want to point out that our deaths, particularly amongst those who are African American, is at 56.8%. For white or Caucasians, our death rate has been 26.4%, or 26.4% of our deaths have occurred in people who are Caucasian, and then about 16.8% of our deaths have occurred amongst what we would call other, or races that individuals indicate themselves or others. Amongst our Latino population, about 84% of our cases identify as not being Latino or Hispanic, and about 16% identify as Latino or Hispanic. I wanted to share that today because as the pandemic has progressed, we know that communities of color have been disproportionately impacted, particularly by deaths. We know historically communities of color in Shelby County have a greater impact from poverty, as well as chronic illnesses, including diabetes and hypertension, which impacts one's risk of dying from COVID. But I also wanted to note that because we do have many more treatment options available, so I wanted to take this opportunity to remind people, one, of the importance of preventing the spread of COVID, but that in the event you exhibit any signs and symptoms, even mild signs and symptoms of COVID, it's really critically important to get tested and to connect with a primary care provider so that you can access early treatment that is available in our community. And as I said, Tiffany is going to speak much more in detail about some of the testing opportunities that are going to occur this weekend. But what I wanted to spend the most time on is the additional interview tool that we've added in Shelby County. So I wanted to highlight some things that we said early in the pandemic. There are limits to the information that's available, and that's limited by interview tools or databases that are used. While we are an independent health department, we historically used the databases associated with the state of Tennessee, and there were some limitations to that database, so we added an additional interview tool that helped us better understand what people did during their infectious period, so that we could use that information to drive communications as well as tailored or more precision type interventions. We have done that since about mid-September, and we look at that data on a monthly basis. So I wanted to share information about 303 interviews that were conducted in November and the information that they reported. So about half of the people who were interviewed and had COVID, so half of the 303 continued to engage in activities of daily living while they posed a risk to others. That means they were infectious and could transmit COVID to others. When we look at the types of activities that they engaged in, we noted that about 76% continue to go to work. We've all talked about job-related screening. There's also been an emphasis on assurance testing in the workplace to identify people early on so they can be excluded from the workplace. We also know that about 40% continue to go about public activities or social activities. And that's anything from going to meet with a friend, going to have a drink with a friend, going to a movie theater, and so on, but continue to be active and social in public. And only 3% indicated that they continue to engage in school-related activities. We wanted to specifically look at how many days people worked while they potentially were infectious to others. We have shared this information before and have seen a little bit of a shift, which is really positive. So about 45% of people worked about 1 day. So they continued to go to work for 1 day before they were excluded. Previously, that number was much closer to 3 days. So by reducing that number, we reduced the opportunity for transmission. But a total of 29% actually continued to work for up to 2 days while they were infectious and posed a risk to others. And this is work in all settings. And then a smaller number, just 10%, continued to work for up to 3 days. So the takeaway there is a reminder, again, if an individual exhibits any signs and symptoms, to please stay home, get tested, and remain isolated until that test result comes back, and then handle things appropriately based on that test result. I wanted to end with some comments about quarantine, but I believe Dr. Randolph will cover this in more detail. There is new guidance for quarantine, and a reminder that isolation applies to those who are actively ill and pose a risk to others. Quarantine is for contacts or those who could become infected at some point. So we want to make sure that we use the terms appropriately, but now there's new guidance on quarantine that allows an individual to go back to work or back to their regular activities at an earlier date than previously. And this clearly will be beneficial for employers as people are able to get back to work, but also for schools so that children can get back to school more readily if they've been exposed. So I'm going to pause there. I'm going to turn it over to Tiffany to talk about testing opportunities this weekend. Thank you.
Thank you, Dr. Haushalter. Good afternoon. My name is Tiffany Collins, Deputy Director of General Services for the City of Memphis. A couple of weeks ago, the city offered various free testing events in advance of Thanksgiving to give citizens the opportunity to know their status before they gathered or commingled. Due to the response of that event, the decision has been made to offer free testing for the next 3 weekends, starting December 5th until December 20th before Christmas. If you think you are sick, if you have symptoms, if you have been exposed, if you have been in contact with someone, if you have traveled, or if you spent time with others over the holidays, we urge you to come and get a test. If you participated in our last testing event, there are no exclusions. You are far more welcome to come back and test again and continue to test every weekend. In addition to social distancing, masking, testing is the next tool we have to keep our community safe. Again, there are no exclusions. This is asymptomatic and symptomatic testing. Please take the opportunity to take advantage of it. It is free and there's no charge to you. You can find more information on our city's website for this event and upcoming testing events. Thank you so much for your time, and again, get a test to protect yourself and those around you. I'm going to open up the floor to Dr. Randolph from the Health Department.
Thank you. And greetings, fellow citizens of Shelby County. This is Dr. Bruce Randolph, the health officer for Shelby County Health Department. I just want to add to what Dr. Haushalter highlighted about first, the disparity that exists in terms of cases and deaths among African Americans in Shelby County compared to whites in Shelby County. The population of Shelby County is roughly 937,166 people. We have experienced 49,631 cases of people who've been infected. That means 5.3% of our population have been infected by this virus at this point, which is roughly 1 in 20. The population of Shelby County, the African American, the black population of Shelby County, is 52.1%. The number of cases, 56.8% of the cases of COVID-19 that occur in Shelby County occur among blacks. Blacks make up 52% of the population, but it's making up 56.8% of the cases of COVID-19. White population of Shelby County is 40.6%, and the white population accounts for 26.4% of the cases of COVID. And you mentioned, and Dr. Haushalter mentioned that roughly 16% of the cases of the COVID occurred among the Latinx, the Hispanic population that makes up 5.6% of the population in Shelby County. Now, when we look at deaths, 62.3% of the deaths that are occurring as a result of COVID is occurring among black people in Shelby County. Though they make up 52% of the population, they account for 62.3% of the deaths. As I stated, white population is 40.6%, and they account for 31.9% of the deaths that are occurring. So I just wanted to really bring that home and break it down so that you can understand the disparity that exists and why we really are very serious about emphasizing to the population that everybody, we must wear our mask. We must practice the social distancing. We must avoid the crowding. We must not gather in situations that occurred over the weekend that could allow transmission of the virus to occur. We must do our part to remain safe. The other thing that I want to follow up on that Dr. Haushalter alluded to is the changes in the CDC guidance as it relates to quarantine and isolation. And as Dr. Haushalter stated, if you are infected with COVID, you test positive for COVID, you are placed in isolation. And you are to remain at home in isolation for at least 10 days, in which you are, if you are no longer having symptoms and without fever for 24 hours without having taken medication, you can be released from isolation after completing those 10 days. Quarantine applies to someone who may be infected because they've been exposed to someone who is a case or who has tested positive. They are close contact. Those individuals are placed in quarantine prior to the changes that the CDC has made, was placed in quarantine for 14 days. Matter of fact, the CDC's guidance is that they still prefer 14 days quarantine, but allows for some alternative approaches. And those approaches are that if a person is in quarantine for 10 days and they no longer have symptoms, no fever, then they can be released and they do not need to have a test. Similar to same as if a person was in isolation. However, there's another alternative. If a person's in quarantine for 7 days, after that 7th day, they're fine, no symptoms or fever, they can be tested. And if their test is negative, then they can be released from quarantine. But in either situation, whether it's after 10 days or 7 days, they are to continue to wear a mask and continue to practice the social distancing and the other measures that they would do, continue to monitor their symptoms and attempt the similar things you would do if they were in the 14-day quarantine. The other thing that I want to mention here and actually announce that according to the Tennessee Department of Health's regulations and rules, actually section 1200-14-01.06 under the title Duties of Physicians, it allows for attending physicians, matter of fact, it requires attending physicians to inform their patients if they test positive for a communicable disease. And they have the authority to place the person and household in quarantine or isolation. And so what we're going to do, in addition to as health officer, I can authorize, and I'm seeking my fellow colleague physicians, that when you test your patient for COVID-19, you get that report back oftentimes before the health department or anyone else. We're asking that you notify that patient and you inform that patient that you are positive, you need to go home, remain in isolation, stay there until you hear from the health department. And so we're going to be calling upon the physicians in Shelby County to assist us so that we can identify people quickly who test positive, put them in isolation, and keep them from doing the things that Dr. Haushalter just identified, going to work when they're positive, going out and socializing and doing other things when they are positive. This is our effort to try to curtail and get control of the transmission of this virus. I think with that, I will stop and entertain any specific questions you may have.
Michaela Watts, Commercial Appeal.
Good afternoon. My question is for either Dr. Randolph or Dr. Haushalter. Obviously, we have tripped one of our trip wires, so I wanted to see if the county can be expecting tighter regulations this week in the form of a new health directive.
Well, we'll be looking at that in terms of, that's one of the trip wires. but we use that as a guidance. And so we look at things collectively at some of the other indicators and criteria before we make that decision. One thing I would say in terms of health directive, we will re-examine and fill in some of the loopholes or the confusion that some people may have, one around the issue of wearing the mask when they're in a restaurant eating, and then also we want to make it very clear to people that it is our position that if you have a tent and it is all the sides are down, that is an enclosed environment. We consider that to be an indoor environment, and all the safety measures that are in the health directive that applies to indoor dining applies if you're in a tent, even though you're out in the parking lot. Any follow-up questions?
Yes, thank you. A quick follow-up. A few weeks ago, the task force members said that they would be engaging in discussions with leaders from surrounding counties like Tipton and Fayette County in order to see if they could possibly coax those leaders into issuing mask mandates. So I wanted to see if there was an update on those conversations.
I'll let Dr. Haushalter address that.
Thank you for your question. You know, we've said at this point in the pandemic, a statewide approach and a nationwide approach is ideal. So the ideal would be nationwide mask mandates. If that can't occur, then state or multi-state efforts. If that doesn't occur, then you try a regional approach. So Mayor Harris and Mayor McDonald convened the West Tennessee mayors, both city and county mayors, and really implored them to implement masking. We were able to share our local data that showed we went from less than 50% masking to well over 90% masking just by implementing the mandate. So we know the mandate makes a difference. At the current time, I don't have a specific update on any new mandates, but I will ask our team to compile that. We did a survey before we met with those mayors, so I will get that information. It may be the early part of next week before we have it finalized, but we'll strive to get that to you to see if there were any additional mandates put in place. I do know the whole West region does not have mandates. There are some here and there that have mandates, but not all counties, and we will continue efforts to encourage others to put mask mandates in place.
Kelly Roberts, WMC.
Good afternoon. Obviously, a lot of thoughts and talk on vaccines right now, especially with Vice President Mike Pence visiting Memphis on that topic today. Can you guys talk a little bit about the state's plan to implement vaccines and what it would look like here in Shelby County as one of those counties with, the highest population in the state? And, when would, say, regular citizens, those who don't have underlying health conditions or those who aren't on the front lines, when could they expect to, for it to be their turn to get a vaccine?
I'll preface my comments with a reminder that newer vaccines are entering the market and seeking approval. So what we say today could change in a few weeks based on vaccine availability. I'll start with your last question first. We don't expect that vaccines going to be available to the average citizen, so those who are not at high risk, until next year. So 2021, estimates are anywhere from March, April to potentially June. And the reason I want to stress that it will be in the early part of next year is that we have to continue all of our other efforts to reduce transmission until we can get more of the population vaccinated. As far as how it'll look here in Shelby County, the sort of big structure is in place. The details of that are being worked out, and I'll highlight a few of those in a moment. There are several of us who have a call this afternoon, actually with the Commissioner of Health and Joint Command, to go into more detail and have our questions answered about receipt of the vaccine and distribution of the vaccine. But the current big plan is that the vaccine will be distributed through healthcare systems so they can administer it to their own high-risk patients as well as their employees. The health department will also receive vaccine, and we will distribute it to others within that 1A category that would not be vaccinated through their employer. That could be first responders and so on. What we know locally, and we've talked about this relative to healthcare systems, is we need to have sufficient workforce to be able to quickly put the vaccine in the field and administer the vaccine. So I can say for the health department specifically, we're looking at having 2 what we call pods or point of dispensing areas or sites, and being able to have those at easily accessible locations. We're then trying to recruit additional people to assist with vaccinating others. So that could be registered nurses who are licensed, EMTs and paramedics who are allowed to give injections as well. Pharmacists can give injections and so on. Earlier this week, the Joint Task Force had a call with the local universities and colleges to begin to recruit staff to assist us with administering vaccine. So our planning is moving forward. There are meetings probably almost every day or every other day to fine-tune what that actual operational plan looks like. We are ready to receive the vaccine in Shelby County. We can mobilize very quickly. I will use this as an opportunity to call for volunteers. So we do have a medical reserve corps, and that's statewide. We encourage anybody, that could be someone who's retired and licensed, somebody who has extra time and wants to volunteer to sign up for the Medical Reserve Corps so that they can assist anything from signing people up to helping people park to actually giving vaccine. And then again, we will work with our local partners, particularly our academic institutions, to be able to get vaccine to the high-risk groups first and then the public at a later time. The other component of vaccine distribution is about communications. Nationwide, there are challenges with people accepting vaccine for a variety of reasons. Those can be philosophical or religious in a variety of different ways. They can also be medical. But we do know in Shelby County, particularly, some populations are less likely to be vaccinated. So we've got to take a lot of time and put attention into communicating to the general public about this vaccine. It's a new type of vaccine, so we need to be able to answer questions that the community has, and to do that now really well until the time that it is available to the general public. So we'll rely heavily on the media to assist with getting information out to the public as well. So that was a long answer to your question.
Well, I appreciate it. I think that's all I needed. Thank you.
Brittany Moncrief, Local 24.
Good afternoon, everyone. I had a quick question. Well, it's kind of a threefold question in regards to the gatherings, in particular the gathering on Saturday outside Love with the Tent. We saw that yesterday they closed their doors, I think, until the 17th. So we were wondering, was that something that came down from the health department? And then also, were there any consequences there for the organizers of that party? And then lastly, how will the health department crack down on events like that happening in the future? Because I know a lot of people are wondering, how did it get that far? And I know it was mentioned about the tents, and now tents are considered enclosed spaces. So was there confusion maybe on the organization's part, or what happened there?
So you have a lot of great questions. I'll try to answer all of them to the best of my ability. If I miss something, just let me know. So yes, that particular facility was closed yesterday under the direction of the health department. If individuals listened in on the health committee meeting of county commission, I did report at that time we were still gathering additional information to assure that we made a sound decision. So one of the things that's come up throughout the pandemic is the role of the health department and our authority. So there are some authorities we have and some authorities we don't have. And when we exercise our authority, we have to make sure we're doing that in a fair and equitable manner. So we had to gather additional information. When I say we, it's primarily me and Dr. Randolph, as well as Mayor Harris's office and our attorneys, to assure that we were making a sound decision on the closure. What I understand happened that evening is that the earlier part of the evening there was compliance to masking and to social distancing, and we require 18 feet between the singer, or in this case it would be DJs, and the audience. That as the night went on, there was less adherence to the health directive. In our health directives, it's clear that one, if there's going to be an event, there should be a plan submitted to us for review and technical assistance to assure a safe event. However, it also says that that event manager is responsible to enforce adherence to the health directive. While we can go out and inspect and do other things, we do not have sufficient resources in Shelby County to police every event and stay there for the entire event. So at some point, there was non-compliance and an inability of that facility, that owner, manager, whoever was present, to actually bring that into some level of compliance. We needed to make sure that we had evidence that was beyond the pictures that we received in video. As I've noted before, pictures are great, but they are hearsay. So we have to have evidence that corroborates what's in those pictures. Once we were able to do that, then we were able to issue the closure notice. We do not have ability to cite anyone for a significant fine. We have to then work with law enforcement, who ideally has to be present at the time of the infraction, to issue a citation. So there is not a financial penalty that will be assessed to the business directly as a fine. What will happen is, because of the closure, that business cannot operate for a minimum of 2 weeks. There are criteria that the business has to meet, and this is applicable to all businesses, before they can reopen. And one of those is submitting a plan to the health department on how they, one, can reopen safely, how they're going to adhere to the health directive, and also how they're going to enforce adherence to the health directive. And then moving forward, there will be a need to make sure that if they have a special event, that special event needs to be approved by the health department. What we can do from our end, and Dr. Randolph mentioned it, is that we learn from all of our experiences, and we look at loopholes that may be in the health directive. I will say honestly, people look for workarounds. So no matter how much we try to get the language specific, and no matter how many people we have review it, someone will figure out a workaround. So we will strengthen the language around tents being an enclosed space, and that should be treated like indoors. One of the things we have to be careful of is if we put a rigid restriction on capacity, that's going to apply to every other event. And so we've got to make sure that there aren't unintended consequences by trying to address this one particular business. That's why I said early on, I know this is a very difficult time for all of us. This is unprecedented in our lifetimes. It's really going to take everybody to do what they can within their power to make good decisions to reduce the impact of the pandemic. So that includes the owner of a business. It includes DJs who may have been told to stop playing and didn't stop playing. But it also is those individuals who went to the event and opted to take their masks off and not social distance. They're all encouraged to get tested. Tiffany said there's testing every weekend between now and Christmas. There's no charge to anybody. We really need people under the age of 40 to get tested. That's really a national push, but for our data, we know really 45 and under, we need people to get tested.
We are out of time. Are there any closing messages today?
No, thank you.
Thanks, everyone. We'll see you back here next week.